Have you been told that the cause of your back pain, butt pain, and/or sciatica pain is due to a tilted pelvis, an anterior pelvic tilt, which causes this big arch in your lower back? If so, I want to take some time today to share with you a couple really simple self-movement tests to help you identify whether or not this is actually the case. What's up? This is Dr. Charlie Johnson, physical therapist. I have my orthopedic board specialty, and I help people all around the world with unresolved or mysterious back, butt, and sciatica pains learn how to fix themselves naturally using the power of the mind and movement as medicine. And if you're confused about the cause of your pain, be sure to check out my DIY diagnostic guide where I share with you all the movement tests that help you figure out the most likely source of your symptoms. So many PTs, chiros, personal trainers, massage therapists, providers who treat people with back, butt, and sciatica problems like to blame the cause of pain on twisted pelvises and different tilts, whether it be an anterior tilt or posterior tilt. Today we're going to talk about this anterior tilt because, again, so many people are told that this is the cause of their symptoms when is it just theory or is it actually the case? All right, so the theory is this. If your pelvis is tilted forward and you have this big arch in your lower back, you've got tight hip flexors. They're pulling you and twisting your pelvis that way, or your hamstrings are weak and therefore they're long, and because you've got tight hip flexors, you've got butt muscles that just don't work, or they're dead, or they're inactive, or they're inhibited. All kinds of different junk, basically, all right? And then what happens is you kink or you close down in the joints because you're always in this arch back position. But here's what's really interesting. Do you have any back pain? No. No back pain. Isn't that crazy? So if you don't have back pain, this would be normal. And in this case, this is my wife, by the way, all right? She's not going to see anybody for a back problem, nor am I trying to fix it, because you don't have back pain, it's not a problem, right? And there are many people walking around with arches in their back or really flat backs, and they have no pain whatsoever. So we really try to medicalize these problems when in fact they're very normal. So just recognize that correlation does not equal causation. So yes, some people with back problems have an arch in their back, but does that mean that it's a cause? So if, who you just saw in the back, all right, started to develop back pain, would it all of a sudden become a problem that she had an anterior tilt? Well, she didn't have back pain yesterday, and she has had that tilt for years, right? But now she has pain, so now it's a problem and we need to fix it. As you can see, it just doesn't make any sense. Now, that being said, when you're in pain, maybe you have certain sensitivities to motion. So you can start to test to see, does that anterior tilt, maybe it's not the cause, but does it contribute to the current pain experience? And so here's how you could start to find that out. Generally, due to the theories that we talked about, and in my experience, although sometimes it's different, people who have this anterior tilt often have trouble and or back pain or sciatica when they are walking because they're in that arch back position. Again, theoretical, will prove whether or not it's part of the issue or not, and or when they lay down. And so when folks lay down, they have a little bit of an arch in their lower back. So let's show you how you can prove again if this anterior tilt needs to be corrected, not for forever, by the way, but temporarily to help create an environment that is more conducive to healing. So let's talk about standing and walking first if you have pain in those situations. All right, so you can see here, she's on a wall, her feet are just slightly out, but there's a hole back there. Ooh, pelvis is tilted. What are we gonna do? Well, what we're gonna do is, let's just say she has pain when she walks or when she stands. The theory is that the anterior tilt is causing her problem. How could we prove that? Rather than going down a whole rabbit hole of stretching our hip flexors and strengthening our core and doing all this stuff without any proof. Let's just prove it. Let's MacGyver a test. So what we could teach her to do is I could say, hey, you feel my hand back here? You feel the wall? The wall works really well. Go ahead and flatten your back against the wall. Do that for me. Great. Now, how did you do that? Just curious. How did you do that?
I tipped my pelvis.
You tipped your pelvis, right. So what she did, all right, is she tipped her pelvis and she tightened her belly muscle. She kind of took her belly button and she pulled it up a bit and she flattened it. Now, that's really extreme, all right? But if you could do that, you get the idea of being able to pull it in and kind of rock your pelvis. So now, just do it a little bit for me. So you got a big hole, now flatten it a little bit. Okay, now can you just hold that position and walk for me? You don't have to go crazy. Just walk, and try not to walk robotically, but you get the idea. Cool. Okay. So now I would say, hey, you tried it out on the wall. You tucked it just a little bit. You don't need to go extreme and walk around like this. All right, you just need to do a little bit. And then you took a walk. Or maybe you're standing there doing dishes and you tucked it a little bit. Do things feel same, better, worse? If she was to say, hey, things feel better, then that tells me something about that position. Notice I didn't go into hip flexors, this, that, whatever. Something about the position of her pelvis right now as it relates to her current pain experience is contributing to her symptoms. They weren't for whatever weeks ago. She had no back pain, but maybe now she were. Maybe there's something going on. So we could start to train her to put her pelvis in that position as needed when she walked. Again, not to make her move robotically and not to fuel her with fear of you're weak, your hip flexors, something's broken, you're out of alignment. No, just to say, hey, do you notice when you flatten your back it feels a little bit better? Maybe that tilt has something to do with it, because you notice when you take it away or you reduce it, you feel better. Cool, do you care why that's happening? Not really, Charlie, I just want to feel better. Cool. So can you, if you need to, can you just tuck your pelvis if you start to notice that symptoms feel a little bit yucky? Great. So that's how you can start to see if it contributes or not. Now, let's just say if it got better, it is a contributor and or it's something you're going to want to think about. If it stayed the same or made you worse, then guess what? Your anterior tilt, if it's the same, has nothing to do with your symptoms. And if it's worse, your anterior tilt actually could help you by going further into the anterior tilt. So it does have something to do with your symptoms, but if reducing it actually made your pain worse, then maybe you actually need to go further into an anterior pelvic tilt, right? If reducing it or tilting your pelvis backward made you worse, so what's the opposite of worse? Better. What's the opposite of pelvis backwards? Pelvis more forwards. Do more of a pelvic tilt. Now let's talk about sleeping or lying down if you have pain lying down. My arm's getting really tired. All right, so oftentimes if you are lying down and let's just say you have pain, again, the anterior tilt becomes something that gets blamed for why you have pain lying down, because as you're lying down, the hip flexors are pulling you in a more forward position, rocking your pelvis, and you need to stretch them and use the so right. No, you do not. You probably don't, okay? That stuff gets crazy. So here's what you want to do. You see how she has an arch in her lower back, as I do, and guess what? Again, she has no back pain. But let's just say she did, and she was told she has an anterior tilt, and that's the reason. Well, prove it. So take the anterior tilt away. How can you do that? Put a pillow under your knees or bend your knees. Now, if the pain goes away, then, well, maybe, notice I'm not committing to anything. I'm just saying, well, maybe we reduced. Yes, we took tension off other things, but we're reduced, and now there's no space back there, the anterior tilt, and we allowed her pelvis to kind of rock backward. So if that helps, then maybe it gives you an idea that the anterior tilt is contributing. And so at night, you might want to put a pillow or two under your pelvis, or you might want to be aware of how you're sleeping so that that tension, for whatever reason that's causing your legs are straight, doesn't cause you to rock into that position. All right, so one other test I just thought of, think of it like a bonus test to see if that anterior pelvic tilt or the motion or the position in which that anterior pelvic tilt causes in your body is contributing to your back and or sciatica symptoms. So do a self-movement test. What you can do is, first things first, she's on her belly. Notice there's a natural sway to her back. Now, let's just say she had pain. Again, she doesn't, let's just say she has pain. So maybe she's laying here and she doesn't feel symptoms. She's in a little bit of an anterior pelvic tilt and a little bit of arch, but not too much. Now, when she bends her knee, go ahead and bend this knee. Watch what happens. And let it down. Let's go again.
Same leg.
Same leg. Can you see, it's subtle, but can you see that she hinges a bit more? It rocks the pelvis more forward because the thigh muscles, right, are pulling, and just the mechanics of the way the rubber bands are pulling causes her pelvis to tilt more. Do it again. More of an anterior tilt, more of an arch in the back. Do the other leg, same thing. Great. And so oftentimes what you'll see is this. They'll say, Dr. Charlie, I don't have pain, but when I bend my knee, or I can do it for them, but let's just say when you bend your knee again, and I go more into that anterior tilt, I'm pointing at the camera, but this anterior tilt, ow, causes more symptoms. Let it down. Now they go a bit away. When I bend it up, ow, more back pain, more butt pain, more leg pain. When I let it go, now it goes away. Do you get what I'm going for? So all I'm doing is I'm running experiments, people, and I'm starting to test. What happens if I take that anterior tilt away? So let's just say that she had pain laying here. Well, if I put a pillow underneath here, then it reduces this curve, all right? Oh, my pain feels better. If I give you more of an anterior tilt, pain's maybe a little bit worse. And then when you actively give yourself more of an anterior tilt, oh, I get even more pain. Do you see that I'm just fiddling with motion and just the mechanics? I don't have to know anything about the muscles. I'm just running experiments, testing, treating, retesting, and assessing the effect of motion on symptoms. I'm studying the movement-pain relationship, all right? So hopefully that's useful. So if when you bend your leg, you notice that your pelvis rocks more into an anterior pelvic tilt and it increases your symptoms, then that is more evidence to believe, not because someone else told you, because you proved it, that the anterior tilt or forcing yourself more into that position is actually contributing, not necessarily causing, but contributing to the pain that you're experiencing. Now, we talked about lying down on your back, right? Just to review, if tilting the pelvis backwards by bending your knees up and taking tension off the pelvis and getting yourself out of that arch, reducing that gap underneath your back feels better, then maybe anterior pelvic tilt is something you want to learn to get out of and or work yourself out of. So you want to learn to live in a little bit more of a posterior pelvic tilt. Another self-test we just reviewed is if you're on your belly, maybe you feel okay there, but if you bend your knee actively, sometimes it kicks people into this low back arch. And if that's the case and it increases your symptoms, again, more evidence that anterior pelvic tilt is something that's sensitive for you and you might want to train yourself out of it. And here's the thing, there's many ways to do it. Maybe a follow-up video. Let me know in the comments if this was useful. Final thing, on the wall, right? When you have pain, let's just say if you have pain standing or walking, you have a little bit of an arch on your back when you stand against the wall. Some is normal, but if you notice that it feels excessive, well then if you flatten it, right, if you are able to tuck out of it, even just a little bit, you don't need to go crazy hardcore, but just a little bit to flatten your back, pulling your belly button up, and then you walk around or you do things and you're like, wow, it actually feels better. Then it doesn't mean per se with 100% certainty that's the problem, anterior tilt, but it does give you some more evidence to kind of prove that, hey, when I take that anterior tilt kind of motion out of the equation, it makes me feel better, in which case, go for it. Notice I care less about the reason. I'm not talking about hip flexor tightness or hamstring weakness or your core being weak or whatever. Some people are just born like that and they don't have any back pain, like my wife, all right? But that being said, I wanted to give you some idea of some things that you can test to see and to prove if anterior pelvic tilt or pelvic kind of malalignment is part of and or contributing to your back, butt, or sciatica problems. So many people, what they do is they take this thing that they were told and they just believe it. And then they go down this whole rabbit hole when they could just do some simple self-movement tests to actually prove it. So be careful of just taking blindly the opinions of experts and or others, even if they are so-called experts, and instead prove it. You don't have to be a doctor to figure this stuff out. You can start playing with movement, find what feels good, find what feels safe, and just proof is in the pudding. When I do this and I take it away, it's good. When I put more of it in, it's bad. And I ran it in a few different ways, and so this is what I've discovered. You can learn to understand your movement-pain relationship, your sensitivities as it relates to movement, and start proving and disproving everything without needing a lot of expert advice or things like that. So if that was useful and helpful, let me know again in the comments below. Hit like, hit the subscribe button, as well as the bell for notifications when I go live every single week. This is more of an off-the-cuff type of video again, so hopefully this was valuable. Until next time, that's all I got. Again, this is Dr. Charlie. I help people all over the world with back, butt, and sciatica problems learn to fix themselves using common sense, but also thinking a bit outside the box and sort of bucking the system. So that's all I got. Chat soon.